My name's Leticia Dirks. I'm a board-certified pediatrician and a certified lactation consultant at Pediatric and Adolescent Associates, a part of Lexington Clinic. Today we're going to talk about the top questions that I get as a pediatrician and lactation consultant. One of the most often questions I hear from families early on is how often to feed your baby. I know a lot of families come in with the expectation of feeding their baby every 3 hours, and we want to make sure that your baby is eating at least that often. If they're feeding every 3 hours and seem to be content between feeds, that's a great thing, but many babies will want to feed more regularly. We typically recommend watching for babies' feeding cues to know when they're ready to eat. You can see signs like a baby sucking on their hands or smacking their lips or rooting around often before you see them start to cry and fuss. Many people don't realize crying is often a late hunger cue, and it can make breastfeeding a little bit more difficult if a baby is frustrated and past that point where it's easy to kind of latch on and encourage a feed. You can look for babies' cues to see if they're full as well. So, of course, if your baby is content after a feed, is able to sleep and rest well, that's a great sign. A baby that's hungry and ready to eat often will be more tense and have a tighter body tone. You may even notice that their little hands are balled up in fists, versus a baby who is full and has had a good feed often will kind of relax and open up those hands as well. It's especially important to remember that if your baby's breastfeeding, you want to make sure they're eating at the breast at least 8 to 12 times in a 24-hour period. Another question I often hear from families is, how do we know that our baby is getting enough milk? This can be a common concern whether a baby's breastfeeding or formula feeding, but I know especially with feeding at the breast, it can raise some worries for parents since they don't know how much volume a baby is taking in at a feed. Looking for babies' cues after eating and knowing that they're content and resting well is a great sign that they're getting enough milk. Whether your baby's breastfeeding or formula feeding, we do often see that weight loss in the first few days of life. And as long as that turns around and they get back to their birth weight by 2 weeks of age, it's not something that we typically stress about. With any baby, it's important to allow for on-demand feeding. So if they're showing signs that they're hungry, like those feeding cues we talked about, we want to feed whether or not it seems like it's been, a typical 3-hour feeding window. You can also look at your baby's behavior with eating to know if they're getting good milk. So you want to listen for regular swallowing in addition to sucking at the breast to make sure that they're getting good milk supply in addition to sucking and latching for comfort. Another common question I hear from families is, should breastfeeding hurt? Typically, we don't expect breastfeeding to be painful, so you may feel a little bit of pressure as your milk supply starts to come in and you get engorged. And similarly, there may be a little bit of pressure associated with milk letdown. I hear from families too that the first few days of breastfeeding after a baby is born can cause a little bit of soreness. However, we don't want to see that it is consistently painful for your baby to latch and feed at the breast. A consistently painful latch can actually be a sign that there's a problem with the way the baby is latching at the breast. You want to make sure that their position with breastfeeding is appropriate, meaning you both are in a comfortable position, that they have a good, deep, wide latch where the lips are nice and rolled out. And if you ever feel like it is painful while you're trying to breastfeed, I encourage moms to release that latch and try to start again to see if it helps things. It's important to look at the nipple shape after feeding as well. It should not look misshapen. Sometimes if it has a little bit of a slant to it, like a lipstick tube, that can actually be a sign that the latch is not appropriate as well. Other changes associated with breastfeeding, like a lot of redness around the nipple, skin changes, significant pain, fevers or flu-like symptoms are reasons that you should reach out to your doctor right away because they can be a sign of a more serious issue like a breast infection or mastitis. Another question families often ask me is, when should I stop breastfeeding? The recommendation for breastfeeding from the American Academy of Pediatrics and the World Health Organization is that every baby should be exclusively breastfed for the first 6 months of life. This doesn't mean that they're encouraging breastfeeding to stop at that point, but it's written that way to encourage introduction of solids to babies around 6 months of age. It is important to make sure that your baby's developmentally ready. So we're typically looking for signs like the baby being able to sit pretty well without support and hold their head and neck up well to make sure they're not at risk of choking when introducing solids. Even when this starts, solids are really more for practice for your baby than they are for nutrition, so it typically doesn't change how much milk your baby is eating. Many families choose to continue breastfeeding throughout the first year of life and start to wean at that point when a baby is getting more of their nutrition from solid foods. However, we have a lot of families as well who continue breastfeeding for longer periods of time. If this is something that's mutually desired for you and the baby, it does provide a number of benefits, including continued opportunities for bonding, continued immune protection from antibodies, continued nutrition as well. Ultimately, we want you to decide to stop breastfeeding at a time that works best for your family. Another question I often hear from families is, when should I worry about my baby's development? So your pediatrician is always paying attention to your baby's developmental milestones at their checkups. So they're going to keep an eye on how they're progressing and let you know if there's a reason to worry. However, you are the one spending most of the time with the baby, so we always appreciate hearing your insight. And if you're worried about something going on with the baby, we would always rather know that sooner rather than later to help connect you with support. As always, if you have concerns about your baby's development or have something you want to bring up with your pediatrician, reach out to us at PAA. Our office number is 859-277-6102.